The Intercept procedure is basically a non-surgical intervention that can help treat chronic back pain. Specifically, it is for people who have degenerated discs in their back, where the discs or in between the vertebrae have collapsed, and the vertebrae are starting to bump into each other and cause essentially bone pain from the ends of the vertebrae butting into each other with no disc in between. And so the Intercept procedure is a technique where we basically insert a radiofrequency probe inside the vertebrae, turn it on, and it dulls the nerve endings to the bone. So basically it doesn't reconstruct the level, it doesn't mechanically alter the spine, but it can decrease the pain or take the pain away because of that bone-on-bone pain that they're having. So it's a great option for people who may not be able to have a reconstructive surgery for medical reasons, or maybe they just don't want to go through a long recovery and a long operation and just go about getting some pain relief. It can be a very good technique for that. It's a common problem to have back pain, obviously. Now, not everybody with back pain will benefit from the Intercept procedure. It's specifically those people who have what we call discogenic low back pain. So the disc is bad and the vertebrae are bumping into each other. So a lot of that workup, we are looking to see, is there any pinched nerves? Is there other problems with their back that would prevent the Intercept from working? That might be a scenario. But in those patients who have bad discs and no real pressure on the nerves and just have the back pain associated with that, the Intercept can be a very effective option. If you are receiving the Intercept procedure, that's something we do right here in our operating rooms. It is generally done under a light sedation. We can do a full general anesthesia if patients prefer, but because we're not making any incisions, big incisions, or doing any reconstructive work, a lot of times we can just do a light sedation. The patient lays down in the prone position, face down on the operating table. We set it up like it's an operation to keep everything sterile. And then we just take some x-rays and we guide the radiofrequency probes into the vertebrae, and we have to turn on the machine that essentially cooks the nerve endings for about 10 to 15 minutes. So you're in the operating room in total for about 20 or 25 minutes. Go on out to the recovery room, they wake you up, make sure everything is feeling well, you have something to drink, and you get dressed and you can go home. So usually, you're here with us in the surgery center for a couple hours, getting checked in, getting IVs, getting all, pre-procedural things done. And then after the procedure is over, you should be able to head out the door in about an hour or so. It's not always an immediate relief, so some people might expect, I had this ablation done, now the pain's going to be gone immediately. It can take time, and it's a variable response. Some people might see that response within the first couple of days, and others it may be several weeks before they really notice the full benefits of the procedure. So when you have it, if you don't feel immediately different, don't lose hope. There's still likely that it's going to give you some benefit in the next days to weeks.